is exactly 8:15. It is the 3rd of January 2022. Assalamu alaikum. Welcome to one and all. This is News and Views on Salam Media, and it is, of course, all about humanitarian journalism. Do remember, you can become a part of the conversation by calling us on our WhatsApp line, which is 061 or connect with us via any one of our other social media platforms. First up, we're going to be talking about the first case of so-called Flurona. It has been identified in Israel, and the media there reported that the double infection was discovered during a hospital visit by a woman who is suffering and presented with these flu-like symptoms or corona symptoms. She hasn't apparently received any of her COVID vaccinations. She is pregnant, and obviously the scientists and the doctors there are worried, and they have diagnosed the woman as their first case of so-called Flurona. To talk to us about this phenomena, the latest one that is, as far as this whole COVID saga is concerned, is senior research scientist at the UCT Lung Institute, Dr. Shameem Jamdullay. Assalamu alaikum, welcome to the program, and always a pleasure to have you on the line.
Walaikum salam wa rahmatullahi wa barakatuh, and thank you again for hosting me.
Okay, I thought you had a well-deserved break, and it's back to the grindstone.
No, fortunately for me, I've got one more week of that little break to enjoy, and as from Monday next week, I'll be back to the grind, as you call it.
Oh, lucky you, you have another week at least. Okay, Dr. Shameem, what do we know about this first so-called case of Flurona? Is it cause for concern? And, you know, in a few months' time, we're going to be in our winter months, and I'm just wondering, what does that mean for us here in South Africa, knowing that we report very high cases of the flu in the country?
Yes, so to start, I just want to make sure that people understand that Flurona is not actually a mixture of the two viruses that gave rise to like a super monster. It basically means a dual infection, or as we call it in our jargon, a co-infection with the coronavirus, which is Omicron right now, which is the predominant version around the world, and the flu, which is prevalent in the northern hemisphere, as you said it earlier, because it's winter season there. And so far, we do not see too much cause for concern. The reason being that the mitigation measures that have been put in place around the world, which are the mask wearing, the social distancing, the constant sanitizing of hands, have actually kept that at bay. This big thing that people are a little bit worried about now, which is the Flurona. And what it manifests as is basically an infection or a co-infection that gives rise to influenza-like illnesses, which is characterized by your usual headache, cough, lethargy, sore throat, and anything else that you normally get with the flu. And sometimes, obviously, an added symptom from the COVID, which could be the loss of taste and more severe respiratory diseases. But so far, we do not see too much cause for concern, and that's, as I said, mainly because of the mitigation measures put in place.
Okay, so when we look at COVID and influenza, they both fall under the same bracket of diseases. Both are viral and can cause difficulty breathing due to the fact that they attack the upper respiratory tract. So does that then mean crucial that you are vaccinated against COVID-19? And as is pretty normal for the majority of South Africans, I hope it is so, because I am very strict as far as my flu vaccines are concerned. I make sure that I have a flu vaccination every year. Is that what we're going to have to do this time around? Make sure that we are vaccinated and we do get our flu vaccines when the flu season starts?
you're absolutely right. I mean, as far back as 2020, in our winter season, myself and all my colleagues in our unit, because we were exposed to patients and exposed to COVID in general, we were mandated to actually get our flu vaccines in 2020. And you would remember that there was no COVID vaccine yet at that stage. And last year, in 2021, as our winter season got underway, we again were mandated to get our flu vaccine on top of the COVID vaccine that we got. And what you need to understand is that generally influenza affects and afflicts with disease mostly the vulnerable group, which are the younger kids, your elderly, and pregnant women. And it is not surprising that the first case of Flurona, or the dual infection with corona and the flu, has actually been picked up in a pregnant woman. And as you rightly pointed out, she was not vaccinated against COVID. So it is extremely important for, again, the most vulnerable group to get both their flu vaccine and their COVID vaccine. And I can guarantee you that there is absolutely no interaction between the two. And what is preconized is that you normally get them with at least 1 to 2 weeks interval between the two. So we normally advise people to get the COVID vaccine first if they've not had it, because COVID normally comes with more severe respiratory disease. And then after that, to get the flu. Obviously, that would be right before the winter season starts.
Okay, we do know that symptoms of COVID is very similar to those symptoms of the flu. And people probably get scared, go probably into panic mode because they're not sure if they've got flu. And you can get flu in summer as well. We know that.
Correct.
So what, can we just quickly run down the symptoms of flu and the difference of the symptoms of corona, though we do know that it seems to differ from person to person as well?
Absolutely. I mean, even the COVID symptoms would differ from people to people. Generally, as I said earlier, flu would manifest itself with runny nose, sore throat, some difficulty to breathe at times, a cough that you would normally have. And the one thing that people need to also understand is that compared to COVID, once you're infected with the influenza virus, your symptoms would normally start at 1 day post-infection. Whereas with COVID, after you've had a contact with somebody who's been infected, it would normally start around 5 days after you've been infected, if you've been infected. And again, the main differences between COVID and flu would normally be the loss of smell that you don't typically get with flu, a headache that is generally much more severe that you normally get with COVID. And we also know that the lethargy and the body pain that you get with COVID is a little bit more debilitating. But then again, in elderly and in the vulnerable population, even in pregnant women who are immunocompromised to some extent, you would normally get these with the flu because your immune system is not as functional. But what I can also tell you is on the science side, we have been evaluating a test, and that's not a PCR, that's a rapid test. So it's those one that can give you an outcome within 15 minutes normally. It has been made by a company called Abbott. It's called a pan-bio test. And this test has the ability to distinguish between COVID, influenza A, and influenza B. And I am pretty sure that in the coming months, even before we hit our winter season in South Africa, it will be approved by the authorities in place here, and it will be rolled out so that we can have a better idea of what's infecting people when they have flu-like symptoms.
Okay, so what happens when we start uncovering here in South Africa patients with Flurona? How are they going to be treated in terms of obviously the medical protocols? Do we have a plan in place already? Or are the scientists busy working on that?
Yes, you're correct. So basically, the caveat of co-infection is not something that's new for us. We have been treating people who have been co-infected before, for example, HIV and TB. We've been treating people who've been co-infected with COVID and other illnesses like TB and HIV as well. And basically, the management of these people would be independent. Generally, flu is treated with a pill that is called Tamiflu. It has been used before, for example, in the epidemics that we've had with H1N1 and all the other flu-like symptoms. And with COVID right now, though we do not have an effective medication that is available yet in South Africa, there is a pill called Paxlovid that has been produced by the company Pfizer. And this could be rolled out incessantly, and I'm pretty sure that it will be available in South Africa. But until this is available, COVID will be treated as it has normally been treated, which is syndromically when you have the different symptoms, for example, your fever, your cough, your congestion, are treated with the normal medication you use for this. And your flu, likewise, will be treated syndromically. And if it requires you to go into hospital, then you will get the respiratory assistance that you need if you are in respiratory distress, for example, your oxygen mask. And possibly, you get your anticoagulant and your steroid in the case of COVID. But these are going to be managed effectively, and I have absolutely no doubt about this in our South African hospital and healthcare system.
Are you comfortable with the current status in South Africa regarding Omicron? And do you believe that we have passed the fourth wave, the peak of the fourth wave? And I'm nervous, I shouldn't be, but I'm kind of wondering what next, especially since we're seeing what's happening in Europe and the UK. And just wondering, what does the winter season hold for us here in South Africa? What can we expect? Trying to be very optimistic about outcomes, because I think we've done well over the past 2-3 months, but still there is cause for concern, is there not?
Yes, we should always be careful. We should always rather be proactive than reactive to an epidemic generally. And I can confirm that the numbers seems to point towards South Africa having passed the peak of its fourth wave with Omicron right now. And I can also tell you that data that have been published by the Netcare group on the 30th of December last year, that was last week, points towards all the indicators of disease severity, hospital admission, the degree of intubation and ventilation of people, and even the mortality to be lower with Omicron compared to any of our first 3 waves that we had in South Africa. So there is a ground to be optimistic. And I think what has helped South Africa in this fourth wave is that compared to a lot of the European countries where you are seeing what the WHO has called a tsunami of cases with Omicron right now, South Africa has been extremely diligent. They have maintained the restrictions, for example, the curfew that was in place, the mandatory mask mandate that has always been prevalent indoors and in some instances outdoor in the country. And this has helped us even in the face of a lower vaccination rate compared to the more developed countries to keep our infection in check. And the one thing that we can also have certainty in saying that I think South Africa is past the worst when it comes to COVID right now is that we have seen through studies that we have attained a certain level of herd immunity that is a blend of the previous infections that have happened in the country and the vaccination that has been rolled out so far. So we understand that around 60 to 70% of South Africans across the country have in some ways been immunized to COVID, either by a post-infection or by vaccination. So when we take that into account, and the fact that Omicron seems to happen and occur with a lower disease severity, we can say that up until now, we are out of the woods. We can go back into some form of normality, as has happened, as you can see, with the lowering of certain restrictions. But again, we need to be careful because there is nothing that tells us that we won't encounter a variant that can be more lethal and more problematic as we have seen with Delta. So being on our guard and being proactive is still the message to push forward. And inshallah, we will get through this during the course of the year. And we will attain what we are hoping would be COVID becoming an endemic condition, meaning that it has actually infected enough people for it to become normal in all population around the world. And then we can go back to some form of normality. And we anticipate that this is going to happen during the course of this year.
And when you talk endemic, really very much like the flu, which has become endemic all around the world, it's something that we will learn to, or already have learned to live with. In closing then, Dr. Shameem, you have indicated that here in South Africa, we have reached herd immunity, despite the fact that we haven't, not as many people have been vaccinated as the authorities would have liked to have seen. Do we still push ahead with our vaccination drive?
Absolutely. Reaching herd immunity doesn't mean that everybody is protected. You will see that every day we're still reporting a certain number of deaths due to COVID-19. And it's not just the deaths that we worry about, because there are people who are hospitalized and who will carry lifelong sequelae with this infection, where they will not recover their full capacity to live and operate and work as they have been able to normally. So the message is still to vaccinate, especially in population who are at risk. These are the people who are older, people who are living with comorbidities that put them at risk of developing severe disease. Pregnant women need to be vaccinated because we have seen how much tears and how much morbidity and mortality it has caused in that population group, where women have given birth and before even seeing their kids, they have passed away. So we need to continue with vaccination. And the reason why we also need vaccination, especially in the context of South Africa, is that we know that variants like Delta, Beta, and Omicron now that we have, generally emerge in what we call an immunosuppressed or immunocompromised population. And unfortunately, in South Africa, we know that close to around 1 out of 5 people, adults in the country, is living with HIV. These people, generally, studies have shown, can harbor and can keep that virus in their body for longer, for up to 9 months in certain instances. And this is when there is a risk of a variant emerging. So South Africa, more than any other country, and not just South Africa, but countries that are neighboring like Botswana, Lesotho, or even India, where there is a significant number of people living with HIV, needs to carry on with the vaccination program, because as the WHO put it, no one is protected until everybody is protected. So this is why we also need to push for the equitable distribution of vaccines, because there is no point protecting one country when next door you have people who are not protected and could give rise to variants that then renders your whole immunization program void.
Well, that's where we leave it. Thank you indeed, as always, for your very, very valued insights and input into this very important discussion. And that, of course, is Corona, or as now the new buzzword that's going to start going around is Flurona. Till the next time, as always, Dr. Shameem Jamdullay, assalamu alaikum to you and shukran for your time. 8:35 exactly, news and views right here on Salam Media. Still to come on the show, we'll be talking with Nazir Ali, President of the World Road Association, and a whole lot more very interesting guests and interviews lined up for you this morning. Do become a part of the conversation. Our WhatsApp line is 061 766 0355.
Freedom Stationery supply Marlin and Marlin Kids pens to me and